Department of Anatomy, P.D.U Government Medical College, Rajkot welcomes you in the lecture series of abdominal X-rays. In this section, we will discuss about the basic principles. For the investigation of the abdomen, various radio imaging techniques are used, like X-ray, ultrasonography, CT scan, MRI. Even in the X-ray, it is a plain radiography, barium studies, etc. are used. Antero-posterior plain skygram in supine position is a standard procedure to investigate the abdominal pathologies. The antero-posterior plain skygram is also known as the straight film, scout film, and KUB film. When it is done in acute condition, it is known as straight film. The scout film is obtained before taking a contrast radiograph, while KUB film is taken primarily for examining the kidney, ureter, and urinary bladder, for which the acronym KUB is used. As I mentioned, it is used for identify the gastrointestinal pathologies, urinary tract pathologies, or any abdominal conditions. Pregnancy is a relative contraindication for the X-ray of abdomen. In today's section, we will learn how to read X-ray film of abdominal region. These are the topics which we should consider while reading any X-ray film. It is that whether it is a plane or spatial, the view of the X-ray, posture, region, side, exposure and lucency, normal structures, visibles, other specific structures, and abnormality. We will discuss each one by one. Plane or spatial. If X-ray is taken without any spatial technique, then it is known as plain X-ray. As we can see, this image is taken without any spatial technique, while this X-ray is taken with the intravenous pyelography, which is a special technique. So this X-ray film is said a spatial radiograph. View of the X-ray film. As we know, in the antero-posterior view, X-rays comes from the anterior side of the patient and X-ray plate is put on the posterior side of the patient. In abdominal X-ray, when we take an antero-posterior view in supine position, the X-ray passes vertically. But when we take postero-anterior position, the X-ray will pass from posterior to anterior side. Here we can see three different images. In the first image, we can identify the posterior structures better. Like we can easily see in the spinous processes of the vertebrae. We can easily identify the posterior superior relaxed spine as well as the posterior. So this is the antero-posterior view. As we know that when the posterior structures are well visible, it is known as antero-posterior view. This is also known as the KUB view because it is used to image the kidney, ureter, and urinary bladder. As I mentioned previously, antero-posterior view is the standard view for abdominal X-ray. If anterior structures are well visible, then it is known as the postero-anterior view, like in this image. The postero-anterior view are rarely taken and it is almost obscure now. Sometimes we take a lateral view also to identify the position of the pathological structure or foreign body. Posture of the patient. Generally, abdominal X-rays are taken in supine position, as you can see in this image. And sometimes to investigate air in the peritoneal cavity, it is taken in erect or decubitus position. In supine position, the transverse colon is comparatively at lower level than the transverse colon in erect posture. As you can see in this image, the transverse colon has reached us almost up to L5 level, while in this image, the transverse colon has reached at L2 to L3 level. In erect posture, we can easily identify the air under the left diaphragm, while it is generally not seen in supine position. So this is the two basic criteria by which you can identify whether the X-ray has been taken in erect posture or the supine position. Sometimes, in some cases, when erect posture is not feasible or not give proper diagnosis, the lateral decubitus position is also given to the patient for the X-ray, as you can see in this image. Lateral decubitus position, here we can see the air under the abdominal wall, and this is the air in the large intestine. So we can see the air under the abdominal wall if the lateral decubitus position is given for the investigation of air in the peritoneal cavity. In abdominal X-ray, the diaphragm, lateral wall of the abdominal, and pubic symphysis should be visible. But as abdomen is quite large area, a single X-ray film may not cover the whole abdominal region. In that case, according to the investigating area, film are taken where some lower part or upper part may be left. As you can see here, we can see the whole pelvic region. So we can say this is the abdominal region and this is the pelvic region. The pelvic region is focused when our target organs are pelvic organs. Generally, side is mentioned on the X-ray in sutulators like L. L indicates the left side of the X-ray. Some where R is written, they may mention the right side of the X-ray. If the side is not mentioned, the student should be able to identify the side of the X-ray based on the orientation of organs in the abdominal cavity, like ascending colon, splenic flexor, hepatic flexor, and cecum. The observer should hold the X-ray in such a manner that the right side of the X-ray remains on the left side of the observer and the left side of the X-ray should remain on the right side of the observer. In poorly exposed X-ray, the bony tissue or the soft tissue may not be differentiable. On the base of the lucency, we can identify the structure like the air in the lung, stomach, and bowel creates a black colored shadow in X-ray film. As you can see here, this is the air in the fundus of the stomach. Here is the air in the lung, and this is the air in the large intestine. Dark gray color is because of the subcutaneous tissue. As we can see here, light gray color is by the soft tissue or fluid, solid organs like liver, It is because of the muscle also. Bowel wall also gives the light gray color. Fluid-filled organs like urinary bladder and gallbladder also gives light gray color, while off-white color is given by the bones like ileum vertebrae. The bright white colors is produced by the contrast material, foreign bodies, surgical clips, artifacts, prostheses, etc. About the basic principles of the abdominal X-ray. In next lecture, we will discuss about the plain abdominal X-ray. Thank you.